So as we're looking at tools for individual learning, we need to look at motivation of adult learners. So adult learners are in your class because of a choice that they've made. Most of them are not in there because somebody has forced them to be. Unlike dealing with like a K-12 type situation. Adult learners are usually self-regulated learners, meaning they have motivation to succeed normally, and therefore they're motivated to learn, so they are what we call self-regulated learners. The educator still needs to determine exactly what their motivation is. Sometimes it's their motivation is to just simply help people. Sometimes it's a requirement for they want to be on the volunteer fire department, for example, and it's a requirement for that. Sometimes they want to be on a paid fire department, and it's a requirement for that. So we need to determine exactly what their motivation is. Adult learners are also have competing priorities, as we know as adults. We have priorities with our families, our children, our extended families, and so on. That's important to recognize as well. And also, you'll need to help them work through some of these obstacles as they progress through your course. Most of your students will need to be taught how to learn and how to study, even if they have done well in the past. This is not something that typically most high schools or even colleges teach. We tend to learn and study the way that we've always done it, and sometimes that isn't the most efficient or the best way to learn. The educator's role is to teach students how to self-regulate using strategies that encourage advanced goal setting, self and peer monitoring, and reflection on performance and improvement. So looking at critical thinking, traditionally we've learned by rote memorization of facts. The teacher told us things that we had to remember. The textbook told us things that we had to read and remember. And we've remembered lots of facts, but not necessarily how to use these facts and how to critically think about them. In recent decades, however, the emphasis has shifted to critical thinking and reflection. Critical thinking involves challenging ideas by actively considering all points of view and counter arguments and weighing the strengths and weaknesses of each idea on the merits of logic, evidence, and sound reasoning. Basically, critical thinking is thinking about the challenge you have in front of you, whatever that particular challenge is. It might be a job, it might be a task, and looking at all aspects of it and how and downsides to doing whatever that task is, and maybe any risks that are involved in doing that task, and weighing those strong points and weak points, and using logic and evidence and sound reasoning, coming up with a game plan to perform that task. An example would be our traditional thoughts on spinal immobilization. We know that in the past, it was thought that the immobilization process that we have went through for the last 40, 45, 50 years was the best way to do it because we were protecting the patient. With research, we have found out that in our goal to protect that patient from a further spinal injury, we've found out several things. One, that those patients are actually in more pain than they are sometimes when we do not immobilize. The costs go up of their care because they're spinal immobilized. Many times there are diagnostic testing that is done that is not done when they are not immobilized. We know that once a spinal cord injury exists, that there's very little that we're going to do that's going to make that injury better or worse. So by using a lot of that scientific evidence that has been gathered over the last 20 years. We determined, obviously, that not everybody needs to be spinal immobilized. So that's an example of some of that critical thinking. And there's critical thinking that goes into even today, the way we do it today. There are still some people that we suggest are spinal immobilized, but not all of the people that we used to. So today we look at evidence-based guidelines and practice, and reflection looking at situations through a variety of different lenses. An example of this is rather than following rigid protocols and policies, we give patients choice now in their health care. It's a little bit more difficult sometimes with EMS care, but healthcare in general is very much into patients' rights and their responsibilities as well. But I can remember when I first got into healthcare that, if somebody called us, we did what we wanted to do. We didn't necessarily take the patient's concerns into our decision-making process. So we're going to look at some tools for individual learning. We know that we have reading assignments. We've all done that, and that doesn't go away with some of the new active classroom concepts. Students that value and complete reading assignments, we know, have better exam scores and increased class participation and increased understanding. So reading assignments are very important. However, some studies have shown that only 30% of college students actually complete their reading assignment. So that obviously is a problem. So then the next question goes to how do you get them to actually do their reading? So why don't students read? They're sometimes unprepared to read. Sometimes there are learning disabilities that prevent them from proper comprehension or a proper speed of reading. Sometimes they have a lack of motivation. There's time constraints as many college students work as well as go to school, either full-time or part-time. Some of them have families, just as any other adult has, family issues to deal with and that sort of thing. So they do have competing priorities. And a lot of times they underestimate the importance. They think that they know a lot about the subject matter and they don't need to know anymore, and they underestimate the importance of actually reading that textbook. So here's some ways to increase the rates of reading of your students. First of all, the instructor must be fully aware of what the book has in it. The instructor, as we've talked about before, the instructor is modeling behavior with everything that they do. So the instructor must read the book, must have read the book, and engage in the textbook. Sometimes they have poor study habits that we need to talk to them about and teach them how to not only read, to read for comprehension, but also study habits in general. The best practice for poor study habits is to read a section of the text and then explain either verbally or in writing. My preference is in writing, what that section or passage actually meant. Again, remember that we know that they need not only the intake of information, but they also need to use that information and do something with it and think about it. So the act of either verbally or in writing explaining what a passage of the textbook says is actually doing something with that information. So I actually had a paramedic class several years ago that I actually gave discussion questions to for them to answer for each chapter. And they had to turn those in, and those were graded. They want to use highlighting sparingly. We've all probably seen people who highlight the textbook, and a lot of the textbook, in different colors, and by the time they get finished, almost every word on every page is highlighted, sometimes in multiple colors. And this, we know, does not work well. Again, people think that, if they've highlighted something, then they've learned it. It's simply the intake of information. They need to do something with that information. So highlighting just simply gives the illusion of knowing sometimes, because they can turn back to their book and say, well, look, I know all of this because it's all highlighted. And they may not necessarily know all of that information. And again, like I mentioned before, we learn from retrieving that information, not from inputting the information. We need to hold students accountable for their reading assignments and reward compliance. One of the ways that this has been done is to um, um, have quizzing at the very beginning of class, more like a pre-quiz, and sometimes people will give a quiz toward the end of class as well, to see how much their students have actually understood. But this is a way of holding them accountable, and then also rewarding their compliance. Have students do self-reflective writing before, during, and after the reading. Very similar to what I mentioned earlier with after you read a section of the textbook, explain it. But this is reflective writing that is usually turned in for a grade during and after the reading. Assign students to write test questions based on the content. This requires they be taught how to write test questions. So writing test questions means you have to fully understand a subject. So again, they're reading the subject matter. They are thinking about it and how to word a question, and they are actually doing something again and retrieving that information in order to write that test question. Thinking of distractors or the various answers can sometimes be a difficult process in and of itself. So that's one tool that can be used, is to have them write test questions, and then that gives you, maybe with some modification or improvement or some changes, gives you test questions or quiz questions for that class or for another class. For those students who just say they have to highlight and they won't cut down on the highlighting, it's important to read or skim the text without highlighting first. So this is where they just simply read, or skim the text, a section of the text, and don't do any highlighting. Then they can go back and highlight key concepts to organize and emphasize content on the second pass. Again, you need to stress to them that highlighting every word of every page is not highlighting key concepts. They can also make flashcards or questions out of the highlighted text and use them to self-test later. Here again, they are retrieving that information that they've learned or that they've read, and they're making flashcards and test questions out of those. So they're testing themselves in what we've talked about in the past, that testing can be a form of learning, part of the learning process. You need to be very selective about what they highlight. Again, highlighting only key concepts and not every word of every page on the book. Do not use highlighting as the only method of studying. So again, it's important that their studying be multifaceted, and that they don't use just one type of study process. So continuing on to look at these tools for individual learning, you've got your textbook. Students should not be the textbook should not be the student's only source of information. That is a base of information, and as the educator, you still need to bring information from outside. These textbooks get outdated sometimes very quickly on certain subjects. So it's very important that, number one, you keep up, you know what's in the textbook, and that you bring in outside information to supplement that textbook. Ensure that the textbooks are consistent with the national education standards. Again, very important. Most of them probably are consistent with the national education standards, but they will address those education standards differently from one publisher, one author to the next. So it is important that you do a side-by-side check to make sure that they're covering the education standards in a way that you want them covered or your institution wants them covered. Use the various elements of the textbook effectively. Publishers don't add pages into textbooks just for something to look at, something to look nice. It costs them money, printing, paper, etc. Costs them money when they print something. So there's a purpose to everything. The table of contents can be very useful. The glossary as well as the appendixes are all very effective tools when they are looking for something, trying to define a word, or looking for maybe supplemental information in the appendix. Learning objectives are a key part of the textbook. They should directly reference and map to the National Education Standards. So you should be able to look at the objectives in the textbook and put the National Education Standards beside them. You should be able to directly map those objectives to a portion of the education standards. They should have cognitive, psychomotor, and affective objectives as well. And again, you may have to change, modify, add, subtract objectives from the textbook. So again, it's important that you just don't take it at face value that I just need to teach from the textbook. Using objectives as a learning tool, one method that I really like that I have not actually used in class yet, but I plan to do that very soon, is the process of having the student take each objective and mark it. For people who don't like to mark in their textbooks, that's what textbooks are for. It is a tool to use. But they can mark a plus for objectives that they already know. So for example, if you have a student, say an EMT student who has had high school anatomy and physiology or college anatomy and physiology, there's some of that information that they're already going to know. So it's important that they go through those objectives, and if there are objectives that they actually know, then they can mark them. And the plus is for those objectives that you know without a doubt that you know. So for example, the big bone in the upper arm is the humerus, and if a student says, I absolutely know that, I don't have to study that, then they can mark that objective with a plus. So that way they know they've got it. The minus is used for an objective that they think they know, but they're really just not totally sure. There's some doubt there. So that objective they're going to have to go back and look at the material, and see if they actually know it or not. Once they look at it and study it, if they know it, then they can turn that minus into a plus, so they know it, and that way they're not going to have to go back and restudy that. An objective with a 0 or an O next to it means that they don't have a clue what that objective means. So if I had an EMT student, for example, that had, we're looking at the shock chapter, and they had no clue what distributive shock was, they would mark that with a 0, so they would know that they have to go back and understand what that objective means. Or if that objective were just about distributive shock, they would have to go back and study and absolutely know what distributive shock is. And then once they could change that O from a minus or to a plus as they progress through that. So that's one tool to use. Some instructors I've talked to actually require that process, and then they check it every day or every week or something of that nature. Many textbooks contain case scenarios. These sometimes will begin in each chapter with a scenario that relates to that chapter. The elements again should map directly back to the objectives of the lesson, which those objectives then are mapped back to the National Education Standards. So you know that that scenario actually has an objective tied to it. Some textbooks have review questions, sometimes at the end of the chapter. These are nice to use for either for in-class review type questions, to have the student complete those, or to possibly used for quiz type questions. Students can also develop test questions or review questions for other students. These should, however, be vetted by the instructor. So again, going back to one of the things a student can do to study is to create test questions. They can then turn these questions into you. You could look at them and say, yes, this is a sound question. The decision making is sound. The distractors are sound. And then you could put those back out to the students to allow all of them then to use those to learn from, to test their self with. You can also use mini lectures with questions every 15 to 25 minutes or so to check for their understanding. So it's a good idea, less than every 30 minutes to check for understanding. You can break that up by putting questions into your PowerPoint slides or Keynote slides or whatever you're using. And as you go through your slides, you get through a particular topic, and then there's a couple of questions then for your students to answer. You may also use a classroom clicker technology or smartphone applications, and we'll talk more about that later with the technology section. So we definitely will address that. Textbook companions sometimes will include audiobooks, workbooks, websites, and there's often online tools through the publisher's learning management system. Some of these things are at extra cost. It depends on the package that is purchased. So if you're making those decisions as to what package your students are going to purchase, you're going to want to know what kind of tools are there and probably have looked at them. All the publishers will allow educators to have a free account or to give them a like a 6-month subscription or something to their content to be able to go through. You can take the quizzes and take the tests and look at the video clips and that sort of thing. But some of these online tools include images or image banks, video clips. Sometimes there's links to podcasts. There's quizzes. There's discussion boards. There's practice exams. Sometimes there's flashcards. So there's many types of tools that are associated with the textbook publishers' websites. Keep in mind that not all students have smartphones or access to computers. So one of the things you're going to need to do is to find out who does have that access. And not only that, but in some, especially rural areas, sometimes if they do have smartphones or access to computers, they don't always have broadband internet access. So speed of video clips, speed of any kind of video might be slow, or they might not be able to get it. So it's important that you look at some other options, maybe being able to put things on a thumb drive or something of that nature. Journal articles are also a good tool for individual learning. Trade journals versus peer-reviewed journals versus opinion type pieces. It's important that the students understand, and also you as the educator, the differences between a trade journal and a peer-reviewed journal and an opinion. So trade journals there's nothing wrong with trade journals. This would be like GEMS or EMS World. Trade journals are very good. They're very good for continuing education for the individual. And they sometimes will highlight actual research that's being done, but they're reporting on that research. It's not the actual research that you're reading. Your peer-reviewed journals is where that research actually appears. And many of these, or all of these peer-reviewed journals go through a rigid process of making sure that the research is sound. It was done with sound research principles. The information is relevant and it's well written and all that sort of thing. And then, of course, opinions are just simply that. There's someone's opinion, and it may be a valid opinion, but not every opinion out there should be taken as fact. Also, students will need to be taught how to read a peer-reviewed journal if that's what you're using. So it's important to, um, before you assign something with peer-reviewed journals, to go through a research article, for example, and show them, explain to them what is the abstract, what is the background of the study, what's the methods and the research and all the statistics and that sort of thing, and the discussion and conclusions and all that. Program handbooks can also be a source of individual learning. They obviously contain policies, lists of resources such as tutoring or library information. These would be applicable, for example, if you are um, teaching at a college or university. A community college, for example, would have resources for people who are having difficulty. Maybe you're doing pharmacology and somebody's having difficulty with math, so you may be able to set them up with a math tutor at that college or university. And then also there's going to be library information, both their physical print library as well as their online library services. Online blogs and social media are also out there for people to learn from. Social media, we need to teach people how to distinguish factual information. Usually anything that is relevant as far as factual information with medicine has references to where it actually came from, so that you can go and check those references. So things with references typically are oftentimes are valid sources of information. There's also what is called free open access education. So this is free online education in medical fields. There's a variety of topics out there and a variety of websites that use this format or this concept. Case reviews are also useful for individual learning, remembering the verbs that describe the various Bloom's levels. We have to be careful with case reviews with cognitive overload. So we don't want to dump too much new information on people at one time. But case reviews are very good. It would be like a verbal case scenario, and you could go around the classroom and either have different individuals, different tables, different squads answer particular questions. Again, this all has to be thought out as part of your lesson planning, as part of your objectives prior to your class. Any case review should also be mapped to specific learning objectives. Again, keeping the end in mind. What do you want them to learn from this? Nothing we do in the classroom should just be to take up time. There should always be a learning objective tied to everything that we do. Practice tests are also available. Tests can be used very effectively to enhance student learning, as we mentioned before. There are sometimes free practice tests out there. There's certainly paid websites out there that will offer testing. So those are all available, and prep tests, for example. Practice tests are known as retrieval practice. So again, testing yourself as the student is a very good option. So here's some techniques for students to make the most of their learning. It's important that they study information in chunks. Rather than reading for 2 or 3 hours, they need to study information in logical chunks, no more than 7 key concepts at a time. So that's very important, and then they need to go back and review that information as well. When reading, summarize each paragraph in one sentence in their own words. Again, you're not just putting that information in, you're retrieving and doing something with that information. And when you have to summarize something, especially in a sentence or two, in your own words, you're really thinking about what that means and what that paragraph is talking about, so that you can be concise. So again, you're retrieving that information and you're doing something with that information. They want to organize key concepts into sequences, pictures, models, or algorithms. Again, very important. One thing that's being done out there occasionally sometimes with EMS and especially with other science classes, is mind mapping. And this is taking a concept and putting it at the center, for example, on a marker board, and drawn out from that circle are a variety of lines that deal with maybe signs and symptoms, risk factors, management of that. And so the more that someone can, again, organize those concepts in their mind and retrieve that information, the more they will learn from that. It's important, especially as adults, that we relate new material to something that we already know. So if you can, in your lecture or in your discussions, if you can relate the new information to information that your students already know, they will do much better with learning that information. We need to motivate our students to be successful. Again, focus with the end in mind. Sometimes some students are self-motivated and others are not. So we need to look at each one of our students individually and see how we need to be able to motivate them. Use the strategies that work best for you, for the student. So again, many students know how they study and what works best for them. If they're failing in that respect, then you can maybe help them adjust their strategies. But most students know how they study best and how they learn best. The student must be an active participant in the learning. That's vital. They can't just sit back and expect you to fill their mind with all your knowledge, and that they're going to be able to learn that, regurgitate it, and use it, and critically think about that information. They're going to have to be an active participant in that. If working in EMS already, apply what you're learning to predict what may happen with a real-life EMS patient. So for example, if you're doing, for example, maybe an advanced EMT class or a paramedic class, they're already going to be an EMT. So if they're working as an EMT, they can think about what scenario or what information you're giving them, and how they may be able to predict information with what may happen down the road with this particular patient. Also gives them a real life opportunity when they're working, as they see a patient, for example, with asthma. And if this asthma isn't treated appropriately, where are they going to go down the road? What's going to happen to them? So it's good for them to think about things like that. Again, that's retrieval practice. When learning a new concept, know the why. Again, vitally important that they understand why they're doing something, not just that they need to do a particular function or skill. Practice the new concepts you're learning in as many different situations as possible. Extremely important, again, changing the context of the same information. So taking that information, those concepts from the classroom to outside the classroom, to maybe trying the individual student practicing that skill at home maybe, or maybe on their children. So if you're bandaging and learning how to splint and bandage, kids love to play along with this sort of stuff. So if they've got children at home, they would love to play along with mommy or daddy's learning, and let you splint their arm. So again, that's very important that we take these new concepts that we're learning and put them in as many different situations as we can. The student wants to monitor their progress and be willing to change tactics if the old ones are not working. It's like I mentioned earlier, most students know how they learn best. Some do not. And if the way they say they learn best isn't working, then they need to be willing to change to learn the most effectively. Learning new complex material takes time and repetition. They need to plan for both of those. So they, again, proper study habits, proper study time, the amount of time that they're studying needs to be appropriate, and they need to have time for that repetition. So time to make those flashcards, for example, or time to do that testing, that's self-testing, in that retrieval practice. So in summary, our adult learners are usually self-regulated learners, but they do have competing priorities, and we need to understand that and sometimes find out what those are. We want to switch from the old style teaching of rote memorization of facts to teaching and evaluating critical thinking and reflection. We want to know and understand the variety of tools available for teaching. We don't want to use the textbook as just our sole source of information. So that is a good base of information, but we want to supplement that with other sources. You want to teach your students how they should study and how they learn. So it's important to, at the beginning of a class, to teach them, number one, how to study and some of the study habits that we've talked about here in study tips, but also some of that brain-based learning. They need to know that what you're showing them is important. So show them, the brain needs to not only take information in, but also needs to use that information and retrieve that information.